Hey everybody, it's Karen Anderson here with Aortic for our week in review. Before we get started, please do me a favor, click that like button, click the subscribe button, and click the little bell so that you're notified every time we go live. Because we go live not only to discuss the posts that we've been putting up over the last week, but gosh, we have really brave survivors that come on and they go live and tell their stories. We interview a bunch of different practitioners and clinicians. And we have our Ask a Doctor that's now morphed its way over here to our AHTV YouTube channel. So you want to click that. You want to be part of all the fun. You want to be able to have an opportunity to interject your opinions and thoughts and banter with us because we have a special guest. She's kind of becoming a regular, and that's Diane Bishop. She is the founder of the Facebook page Aortic Health Unlimited. Hi, Diane. Roll Tide.
Roll Tide.
We got to get it started
Let's
like that,
do
right?
this. That's right. Let's do this, guys.
Roll Tide. Let's get started on our Medical Monday. So, at any given time, community members are preparing to have their follow-up visits, or maybe it's their annual visit with their physician, could be their surgeon, cardiologist, primary care, whatever. But sometimes people are actually meeting their physicians for the very first time. And we have to ask, is there a way to actually be prepared for these visits? So, there are. And some of them would be, if you have that scheduled appointment already in your books with your doctor, as you're sitting there wondering how to make the most of that appointment, there's some tips to help you prepare the best way you can and get the most you can out of that visit. So let's check these out. First one, write down your symptoms and any questions you have. I don't care how seasoned you are at aortic disease, you sometimes think of them earlier in the year before your next appointment. Just have it someplace in a journal where you can write it down, because when you pull that page up, it's going to remind you, oh, yep, that's right, that thing happened. And I want to know, an answer to my question. So any symptoms you're experiencing or you're noticing right after taking medications, how long has it been going on for you? What are those symptoms? How are they impacting your daily life? All of that's included. And those are not questions that are given to you on those forms you fill out before you get seen and taken back. Those are usually topic points and things that you want to talk about. If you've heard about any tests or upcoming test options that we've presented here or other organizations have presented, write all those questions down. Have all of that with you. I don't know. I definitely have to write it down, because if I don't, I'm going to forget what my question was. I don't know about you, Diane, but I find writing it down helps. What do you think?
I do the same thing anytime. I'm constantly writing myself notes, but from the time I leave the doctor's office or anytime I remember anything, I will sit there and make a note of it, what I want to ask, what am I feeling at that time, and some possibility, if I talk to a friend or whatever, what they think, hey doc, what do you think about this? Can I do this? Is this safe for me to do? Uh, my mind comes a lot of my thinking, and I'm sure you do too, Karen, is in the evening times when my mind gets to rolling. I'm laying in the bed and I can't get no sleep. So I'm thinking of all kinds of things, voluntary, involuntary things. But I take and I keep me a note, little journal, book, piece of paper, post it, and a pen, and I just make me a note. And that's when most of my creation and my thinking come in on anything, is at nighttime.
Right. Exactly. I know that because I see
Yes.
you're up. Usually telling everybody, why am I still up? I'm still up. I can't fall asleep. Here we go again. I'm still up. So I now know all that you're doing while you're still up. Okay.
Yeah.
Make sure that you bring your medical records if you have anything you need to discuss, and that list of your medications, because they're always going to want to update them. Now, what I am finding is a lot of hospital systems for the first time ever are starting to join forces. So you're hearing the words like Epic are coming out. More and more hospital systems are using Epic, which is becoming a well-known portal system. So anytime you're anywhere and you have a medication change, excuse me, it's going to show up in another specialty office computer. But you're going to want to double check all of this with you. So if you have any kind of lab results that you took from a radiology center or what have you, make sure you have these imaging reports with you if there's something specific you want to discuss. If they ordered it, they're going to already have it. So less is sometimes best. But your doctor should be able to help you understand the results of these tests, not just say, everything's normal, everything's fine, see you in a year. If that doesn't sit well with you, that's perfectly normal and acceptable. Ask for them to take the time to explain it to you. And I know that these appointments are slotted to last about 15 minutes, but I am of the belief that my time is very precious and it's very valuable, just as much as theirs is. And so if I'm going to have questions, then the next person's going to unfortunately be a little late because I'm entitled to my time to leave that office feeling comfortable and more educated than when I walked in. So any of your drugs that you're taking, the times that you're taking them, make sure you have all of that because whatever nurse assistant is going to ask you these questions beforehand. Once you agreed, have it all ready.
Yep.
Okay.
Absolutely.
Yep. And definitely arrive early because I know a lot of us, when they say get there 15 minutes early, we think, we really don't need to. But you really do because there are more detailed forms now that some of these physicians are giving us, especially when we're at that 1 year mark and it's the next checkup. There's a lot more information that they want. And I think that it's important. Use that 15 minutes, make sure any last minute questions you have are written down and be honest. It's very important to be going into your appointments very honest with your physicians. Ask for clarification about anything that you don't understand. Your doctor is there to help you, not judge you. And so I would also say, in my humble opinion, if you are feeling judged and that communication is breaking down and you're not having that, right, that joint experience, it's time to consider a second opinion, if not a different physician, because that communication is extremely important. There's a lot of vulnerability and trust. What were we going to say, Diane? Go ahead.
You're exactly right, Karen. If that doctor does not give you the time that you feel like you deserve, because it is your time when you go in there, I'd go for a second opinion, consider looking for another physician. They get paid, and it is your time. And nowadays it just seems like I always say they treat you like cattle, and it's everywhere. I don't know, it's just like they come in, it's like if they stay 3 to 5 minutes, that's crazy. But of course I don't give them the time to leave my room from that time, that. So I take my time. I'm
Right.
considerate of the other person, but I make sure that everything that I have gets answered. And I have very good doctors and a very good uh person and physician relationship with them, to where they do take the time. And I mean, we're very close, and he's very understanding of everything and knows my history very well.
Mm-hmm. Right. Well, I think with any good physician office, if the doctor's running late, that already tells me something good. A little late. I'm not talking 45 minutes late, because if they're running late, that means they're treating that patient the way I'm hoping they're going to treat me. So that makes me happy. So sometimes I actually will call the doctor's office and I'll be like, "It's Karen. How late are we talking? Like,
Mhm,
is he or she running 15? Is it running a half hour?" Because then I can
mhm.
judge myself in my traffic, because I don't want to end up sitting there for too long either. You know what I mean?
Right,
So
right.
again, part of the relationship.
Mhm.
Follow up and follow through. After your appointment, you want to make sure that you understand your doctor's expectations from you on if there's anything you need to do and when you need to have them done by. So, if you have prescriptions and you need refills, now's the time to ask your doctor to put those refills in. Now's the time to ask questions about, why are you having me take them at a certain time frame during the day? How is it being metabolized? When do they actually kick in and work? What should I expect? Any reason I should call you if I'm not having a favorable outcome? Excuse me, this is that COVID from weeks ago.
Mm.
Here's its ugly head. Okay. And again, if you have any follow up appointments or tests, you want to put them on your calendar right then and there because you don't want to miss them. Ask any questions you have about what that test might entail. What should you expect? Any kind of blood work you need to have done beforehand, or anything you need to do just to basically prepare. And double check that you know how to access the online portal. The portal is your friend, even if you're technologically a little disabled or less able than some of the young folk. Portal's your friend, because if you talk to your doctor, find out the best way your doctor wants you to reach them. Some doctors will actually give you their cell phone. Some would prefer you to strictly go through the portal. Some might give you their email. Find out what's going to work and the expectation of when they should reply. There's nothing worse than going into a new doctor and now you're sending them a message on the portal and it's like, to you, it's important. You're thinking you're going to get a phone call or a reply within the next 4 hours, but they may actually not address anything until after 7 p.m. If you don't know this, you're going to have all these bad thoughts about your doctor. So set the clear expectations. Just like we tell them, you can reach me on my cell phone. Don't call my house phone. Don't send me an email. Please don't, send me a text. Do the same with them. Ask them their what their preferences are as well. Go ahead.
Mhm.
Got anything else you want to add?
I do. That's in regard of your doctor taking time. This is as far as my husband when he went to a doctor, and of course, I went in there with him, and the doctor, Ricky was telling him, "Well, this is wrong with me. Something with a knot on his back, and well, that's da 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 da." He was in a hurry, and then Ricky says, "And this right up in here shoots up in here." The doctor, I quote, said, "No, Mr. Bishop, I know what you're trying to do." He said, "You're not going to conjure up something today." I said, "Excuse me?" And he says, "No, you ain't going to sit there and conjure up nothing in this office today." And I says, "Come on, let's go." That's just, that's the rudest thing, and I never dreamed that would happen, but it did
Mm-hmm.
happen. And
Yeah.
when you go to your doctor, you should be able to tell him what is wrong, not just one thing. Because if y'all knows, when you go to a doctor, just like with my back, I went to the doctor to talk about my back pain. And I had trouble. I got screws in my neck, and I told them that I'm having swelling in there. Well, which one hurts you most? Let's just work on one. It's just like, I don't know. Sometimes I feel like it's a money racket, but I guess I'm getting a little bit off subject here.
No, I think it's important.
Yes.
I think a lot of people feel like you because it does seem like sometimes people are being herded in like cattle. Every time they get another
Yep.
person in, they get to cha-ching, cha-ching, cha-ching. And if
Mm-hmm.
we get this opinion that they feel like if they have to sit and listen to us, woe it out all the things that we experience. Well, now we're cutting into that next cha-ching that they can get because they're already billed you for this. You know what I mean? It's
Right.
not like an attorney, they're billing you every 15. But if
Mm-hmm.
you tell them this hurts, well, now they can, which is so silly, now they can examine you. Like, remember the days when you got this great big exam? Breathe in, breathe out. Let me check your
Yeah.
ears, your nose, your throat.
Uh-huh.
I mean, that all gets billed. You get charged for that. So
Uh-huh.
it's just crazy how some doctors are just bypassing a lot of that. And I'm like, well, this is it. This is my exam. I mean, that's just rude. I'm glad that you just said, let's go. Time to find a new
I did.
doctor. Forget that.
Me too,
There was a,
Diane. I'm glad you did that too.
thank you. There was a few other choice words, but I'm not going to let you bleep me, Josh.
Ha. We want
No
to
bleeping
say
allowed.
we want to say hello to Christina and Ryan. Ryan says, "Hi, I'm here to say hi to Joshua." Ryan,
Oh, well then, you know
Hello,
what?
everybody.
Hi, Christina.
Hey, Christina.
see what you
Hi,
did,
Ryan.
Ryan? You got us all in trouble.
Hi, Ryan. All right. So, oops, I just hit my new fancy little microphone. I don't know.
Uh-oh.
I've got too much around me. I got to use this
Oh,
setup. All right. We are moving into topic Tuesday. All right.
okay.
A lot of information from Duke, our fourth year medical student who is assisting with these posts. So this was his week to come up with. So we're getting back to the diagnostic testing, and we've already talked about echocardiography, your echocardiograms, and we talked about CT. This was the stuff that they've shared over the last couple of weeks, and on this particular day, they were going to discuss with you a little lesser known imaging modality that's called. Do you know what TEE stands for? Transesophageal echocardiography. Transesophageal echocardiography. That's what a TEE stands for. And it's another pretty important way that you can actually detect an aortic aneurysm or a dissection. So a TEE, usually underneath of some light sedation, is actually a probe that enters your mouth and advances along the esophagus. So it's not in your breathing tube, right, which is your trachea. Because the esophagus runs parallel and close to the thoracic aorta, it actually can give high resolution images of nearly the entire thoracic aorta. It gets it really, really, really close, closer than your echocardiogram that's got to penetrate through your sternum and all of that. This goes right down there and just is right there next to your aorta. So it's kind of cool if you think about it. So in this diagram, you can actually see the TEE probe here is seen within the esophagus on the right and is noticeably nearby important structures like the heart on its left and the aorta on the right. And so here we are. This is your trachea, that's your breathing tube. This is the esophagus, and here they have passed that TEE through, and it's kind of right here at the heart, right here at the aorta. So it goes into your mouth, down your esophagus, which leads to your stomach, stops here and was like, cool, we're going to take a few pics of your thoracic aorta. So they can really get and move this along and get some really nice resolute images of this area. So it's kind of like that 360 around imaging. So the key advantage of having a TEE over a CT, because I didn't even know there was a key advantage, but there is, or an MRI, is that it can actually be done very quickly. And if it needs to be done, it can be done in the ER right next to your bed in the emergency room. It could be done in the operating room. If you're in the ICU and there's a reason, they can just pull this to you versus taking you to this machine. So it also provides a lot of information about the functional status of your aortic valve, which I know can be seen in your echoes or your echocardiographies, but this can give even more detailed information about how your valve is operating and how it might play a part with the aortic dissection and the blood flow and any clots in the thrombosis. We talk about that, that form in the false lumen. The TEE also offers a rapid and relatively inexpensive way to diagnose aortic disease. So that's another key point too. It's definitely less expensive than your CT or MRI, but there are some drawbacks. And so the major drawback is it can be uncomfortable, but again, there is a degree of sedation involved, and because the probe is going deep down your throat. So they don't want you awake. They don't want you, you're not going to have general anesthesia, but it's kind of like that twilight sleep, but you won't even know that it's going in or coming up. It's almost like if you've had your colonoscopy and you've had an endoscopy, anything that goes in the mouth and the esophagus, it's the same thing. So you're in that twilight sleep, but not where you're clearly not having a conversation with the tube, put down your throat. So you won't really realize it. It doesn't really at the end make your throat extremely sore or anything like that. I've had one done. I've also heard from community members. It's like you wake up and you close your eyes, you open your eyes, it's all done. It's very quick. So you had one?
I had one when I first dissected Karen, but I was awake.
Oh.
I was awake. They had to rush me to surgery, but it was right before they took me in. They took this thing and they said, that, usually I did not know what it was. They said, look, we usually sedate patients, but we don't have time. And
Wow.
what they'll do, they want to go in there with a camera. I'll have to swallow it. And I guess it's tapped like a balloon. And they wanted to see the dissection, take a look in there. And I had to swallow it. And I was like, oh man, it was bad.
Not fun. I mean, I guarantee, obviously there's occasions when they need to. I've had an NG tube while being awake, fully awake. They passed it through my nose down into my stomach. And when they did that, I was like, okay, you got it down, take it out now. And they're like, yeah, no, this stays put for a week. So sorry you had to do that while you're awake. Eek, sorry, yuck. All right.
I have a question, Karen.
Yeah.
Okay. And to anybody else out there, now, later, or what have you, has anybody, when they had the tube put in their mouth, have you noticed? Yeah. Has anyone ever noticed there for a long time a narrowing of your trach, trouble swallowing for a long period of time or from time to time? And I'm not talking just the first 2-3 weeks after you come out of surgery and that's taken out. But I know like the first couple years, it was hard. My food had to be chopped in small pieces because I had trouble swallowing. Now, I don't know if that's just me, but that's a question I'm curious about.
Yeah, that's interesting. We know we're going to have our Ask a Doctor coming up on September 19th. You could always ask Dr. Prakash that question and his thoughts. We'll get into our events coming up in September in a minute. There's a couple doctors you have many opportunities to ask, but
Okay.
I would think coming right out of it, there would be a degree of swelling and
Right.
it wouldn't be permanent. But I don't know. I actually can't remember if I ever had any problems. I only remember right then and there. I don't remember
Mhm.
anything for those first like year or two. It's such a blur. I don't know.
Hold on. So Ryan here says, before they discovered the massive amount of anesthesia I require, I was wide awake for my first TEE. Not pleasant. I've now had around 12 TEEs. They're a breeze when you're asleep. And then he said,
Yeah.
I can barely brush my teeth in the morning without gagging. So heck no to the awake TEE.
Yeah, no.
Mhm.
Yeah, I would
I
think
feel
only in
your pain.
the most emergent situation, I can totally understand that. Well, so I think that was supposed to say, I'm not sure what the sentence is, but the typical features of an aortic dissection are you have that double lumen, which is a true lumen and a false lumen. So when you think about a tube, if you dissect and part of it comes away, I don't know if you can see
Mhm.
that, it creates two channels. One
Right.
true feeds the blood flow to everything else. One false does not go anywhere. And typically, you almost hope it thromboses or forms this clot throughout. Okay.
Mhm.
So these are actually separated by a mobile membrane that can be seen to move back and forth with each heartbeat. And it creates different flow patterns within the true and false lumen. So below is actually an image obtained from a TEE with its colored Doppler showing the presence of a false lumen created by the dissection, which is designated as FL, and the TL as the true lumen. So the red and the blue is a function of Doppler to indicate the direction of blood flow. So um, there you go. And don't ask me to explain any more about this because I'm not a medical professional. Just repeating what I'm reading. If you have a question, you should
Okay.
definitely take it up with your doctor and your radiologist. They love explaining this stuff. So, yeah, true lumen, false lumen. My true lumen's very tiny. My false lumen's a lot bigger. So that's just interesting. All right. So
Mhm.
that's all that he kind of had for the TEE and aortic dissections and aneurysms. But hoping it's helpful in describing the wrap up of the last types of diagnostic tests that we typically see between an echo, a CT, MRI, or the TEE. And we've got one other exciting thing coming in this next week, and then it's all going to be about September, Aortic Disease Awareness Month. Lots of info coming. So that was our topic Tuesday.
Nice.
Yeah. Let's move on to Therapeutic Thursday. So gaining a lot of popularity, especially in recent years, especially as much as TikTok has taken off and, you know, or probably as much as I've really got into all of this, but it's called ASMR. I'm not sure if you know what it is, but it's basically something like this. Do you hear my nails tapping? No, you probably can't because it's a
Oh.
really good microphone.
Uh-uh.
But anyway, I
Good.
guess I'd have to be very close and I would really have to whisper like this. Like, do you hear me whispering? Like really close and talking like this. Anyway, it's bizarre, right? But ASMR stands for Autonomous Sensory Meridian Response. Trust me when I tell you, if not seen this stuff, you need to check it out. But it basically describes this tingling sensation that some people actually experience in response to certain sounds or visuals or different stimuli. Like, oh, I don't know if you hear that. That's my dog barking. If you do, she's saying hi. Okay. So it's also known as a brain massage. And I promise you, give it a try and see if you don't feel like your brain has been massaged. But it's been associated with relaxation, various forms of calming, producing sleepiness. Okay. A lot of people use it as a way to cope with stress, anxiety, or insomnia. So there's many different types of ASMR triggers. So basically what it is somebody gets really close to their microphone and they whisper and or they'll tap and scrape the microphone with like a brush or their nails or they'll crinkle paper. A lot of people that open up all their Shein and Temu packages like to crinkle the wrapper and you listen to them peel it open. Okay, right? That's part
Mhm.
of it. People really love it. My personal biggest one that I absolutely like I love is when they take floral foam, you know, that green stuff. This
Yes.
lady, she pours into it all these packets of glitter before, and then she goes live and it's all wet and she's holding it. And so when she squishes it with her hands, it's like an explosion of glitter colors. And I am just like, when she scrapes it, it's like I could taste it. Like, it's just so cool to me. I never knew I liked this kind of crazy stuff, but there was another woman too who she'll get on there and just tell you all these wonderful things about yourself and like tell you how great you are and what a good person you are. And it's all these affirmations and she whispers it. And I could watch it, hours will go by and I just am, it tingles. It just, you know, when they take their nails and click, 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 I am just in love, in love. I think it's pretty cool. And I think everybody should just kind of check it out once. I mean, there's a lot of them, especially on Snapchat. They'll have videos of they'll like squish balloons in grates
Mhm.
or you know sand and the gooey stuff. I don't know what that stuff's called anymore. I can't think. But it's not like this. It's not a scientific phenomenon, is what they say, and there's not a lot of research on it and what it causes and what the effects are. But some studies have suggested that ASMR may actually have some positive benefits for mental health, reducing stress levels, improving your mood, and enhancing your overall well-being. Some people also claim that it does help them fall asleep faster and better. So we do have a link here that'll take you to like a bunch of different samples. I think it's like 3 hours or so of sampling of these videos,
Mhm.
and you got to check it out. I think it's wild. You know what I'm talking about, though, right?
Yes, and K-Bug, my granddaughter, she likes watching it, and like she likes even doing it. Like she'll get the squishy ball, go
Yeah.
buy one, and then cut it open. She said it's so satisfying. I said satisfying. Don't get that in my car. That and the little balls, the Orbeez.
Yes.
Yes, I know exactly what you're
Yeah.
talking about,
It's
Karen.
just,
Yes.
it's like a visual or a auditory stimulation that's just like
Hmm. Right.
mesmerizing. It's just,
Right.
it's like Dr. Pimple Popper on a different level. It's like when I watch them do that on there, they can't get to the end result fast enough. I am like clawing, like I just get to the end result. Like I don't have the patience to watch them dig at stuff. I just want to see how it all ends. I love it. But I'm kind of sounding like a little freaky, but okay, yeah, check it out if you get a chance. That's our therapeutic Thursday. Okay. Friday, we keep reminding you every Friday, it's our annual, but fifth annual this year, Aortic Hope campaign. It is our This Is What Hope Looks Like campaign. Basically, it's our community campaign. I cannot believe that Aortic Disease Awareness Month is like soon, you know, like less than a month away. It begins. It starts on September 1st. For the whole month, we focus our time and attention on providing you educational and informative posts from a variety of sources. This can come from the Society of Thoracic Surgeons patient page, Edwards Life Sciences page, American Heart Association, blogs created by some of our medical students, some doctors participate. There's a lot of really fun stuff and some really good contests sprinkled in. This year, we
Mhm.
have some exciting news on where we're going to be pulling some experience of these articles from as well. We'll get to that in a minute. But September 19th is Aortic Disease Awareness Day. It started off being just Aortic Dissection Awareness Day, and rightfully so, became about the disease because dissections are very rare, but aortic disease is a lot more common than anybody realizes. And before you get to the dissection, we probably have an aneurysm, although I know there's cases where there isn't one, but the whole goal is to educate the community so that we can avoid the rare dissection. But if we want to celebrate that as one
Mhm.
day, that's awesome, that's wonderful. But we want you to be part of our celebratory video. So it can be a picture of you with your doctor, it can be a picture of your dog. I don't care what the picture is. We just don't want it really hardcore medical related because this is all really about hope and where we are now. Send us your picture to info@aortichope.org and put that word hope in the subject line, and we'll put you in our fifth annual community hope campaign video. And if you want to check out what the last one did, there is a click here on the link in the blog, and you can check out what last year's video looked like.
Mhm.
And they're really awesome to see. So you have to do that.
Fun to see.
Yeah. All right. We've had a few new Hope ambassadors sign on with us. I know we've still got 2 or 3 more that we need to announce. So we're sprinkling them out to you. But as we mentioned, Duke is our Topic Tuesday social media administrator. And so he is helping with some of those medical topics that we're doing. Duke, he recently joined us, and he is currently a fourth-year medical student at Harvard. He aspires to be a heart surgeon, so we always appreciate that. Outside of school, he's very passionate about community service, outreach, and a lot of sports such as volleyball and basketball. So we do welcome Duke. Thank you so much. And our newest team member is Nikki Matesi. I said the name right, and I'm so excited about it because I always butcher her last name, but it's Nikki Matesi, and she is also a social media administrator. She's actually from Akron, Ohio, and she's an assistant buyer for a jewelry company, and I think it's a wedding jewelry, actually, which is kind of cool and exciting. She's also a type A aortic dissection survivor, self-described proud fur mama of 5 dachshunds. That's got to be a lot of fun. I would have to put them all in costumes, all different types of hot dogs, like one with sauerkraut, one with mustard. I just, you know what I mean? One with just ketchup. All right. So she loves going to sporting events and traveling whenever she can. I know she just recently traveled because I saw those palm trees. If there's a beach and palm trees, she's feeling in heaven. And Nikki's going to be volunteering, as we said, in the capacity of social media administrator. So we welcome Nikki. Thank you so much for helping us out. All right, that leaves us to, we just had a brave survivor go live this past week and telling his tale, and that is Jack Crow. Now, Jack Crow is not only a type A survivor, but he's also the founder of a Facebook page called Aortic Athletes. And what I love about Jack and this page is, number one, he's very engaging with Dr. Prakash out of UT Houston, who's running that research program we're all talking about exercise for the aortic dissection patient. And he engages with a lot of other physicians, specifically asking those like wild questions around athletics that we all don't know the answer to. We're all told different things. And I know it's because maybe we experience this differently, but I also think that's because there is no one set thing that fits everybody. Do you know what I mean? There's going to be some room for wiggle in there, but nobody's really studied it before. And so he's asking these pretty interesting questions, but he's fairly new survivor. I mean, we're getting ready to hit year 3, but he was 60 years old when he dissected in 21 in the wilderness near his cabin in Upper Peninsula of Michigan. Yeah, so nobody wants to be in the wilderness of anything. But he had emergency open heart surgery several days later in rural northern Wisconsin, and that was to replace his ascending aorta. Then he had follow-up open heart surgery 6 months later at Cleveland Clinic to replace his aortic arch. And prior to that, he worked as an executive director at Year Up Chicago, which was a workforce development not-for-profit. He was also the founder of Cristo Rey Jesuit High School and Christ the King Jesuit College Prep, where students from lower income neighborhoods could work at large corporations to earn their tuition. So before his not-for-profit career, he was a partner in Winston and Strawn, a very large law firm in Chicago. But pre-dissection, this is the crazy stuff. He was also an Ironman triathlete, marathon runner, endurance cyclist. Yeah. So post dissection, to somebody who lives this world, when you come out of a dissection and you're told, okay, no, your whole life has changed, there's a couple different groups of people. There are people who just say fine and they don't ever move again. I mean, you're talking the worst extreme to the other worst extreme where they're like beating the hell out of their body. So I think those are the 2 worst extremes. And then there's people in the middle towards the right-hand side that are like, I'd like to be more active, but I don't know what I can do or can't do. And then there's people that are really active and they're like, but I don't know if I'm pushing it or not. And then there's a whole range of people in the middle. So post dissection, he definitely still likes to bike. He likes to jog. He likes to swim open water. So he does that when he gets up towards his cabin. He also is participating in this first aortic dissection research study on exercise that Dr. Prakash is having. He's been married for over 30 years to his wife, Ava, and they have 2 children. I'm going to guess it's like Sierra and Ryan. I hope I'm not butchering the one child's name, but and again, just this year, he started that page on Facebook called Aortic Athletes. And I have to say, like, what I really like about this page is There's a lot of people I know in the community, I know you know this, that when we hear about races or whether it's 5K, 10K, whatever, people tend to get up in arms. They like get all attitudey. Like, why is everybody raising money by doing races that people know we can't do? Well, nobody said you can't do. And even if they did say you can't do a running race, nobody said that you couldn't walk. And even if
Mhm.
they said you can't, for whatever reason, walk a 10K, nobody said you can't walk around the block. And that's what's so great about some of these pages, like Carmen David's Run for Aortic Health that's coming up in September, is you can do anything that your doctor has cleared you to do, anything, and still participate virtually if you're not in the
Right.
area that she's in Texas. And what I love about this Aortic Athletes page is they're very welcoming. They don't make you feel like you can't. Instead, they make you feel like whatever you're passionate about, once you've talked with your physician to figure out how to do what you're passionate about, just try. And
Mhm.
whatever you're able to do, hats off to you for doing it. So it's not a competitive page, although we view athletics to be competitive. Do you know what I mean? So I find it I find it very welcoming, and really the message I take away from all of these amazing athletes is being an athlete is however you define it. However you do, you sitting in your she cabin, she place, she
Yes.
cave, doing art for hours, that's pretty athletic. Not everybody can use their arms like that and just focus and do that kind of craft work. So I look at that as being somewhat athletic because you need to have
Mhm.
stamina to do that. It took me a while to start painting again. So
Yeah.
I think that they're very welcoming, and I do highly encourage everybody just to check them out, see if it
Mhm.
resonates with you, see if you feel the same way I'm describing. If you don't, that's okay. You'll find something that eventually will resonate with you. But Jack, I think, has a presence that is very engaging and very empathetic and very supportive. And so I'm very excited to say that he's actually going to be going live, which is like a long time since anybody else has gone live on Aortic Hope in doing a Q&A. So I'm so excited to be a follower. It's great. He, as a Hope ambassador, as our aortic athlete, will be going live interviewing a doctor named Dr. Churchill. This is on September 6th at 7 p.m. Eastern. So we will get details up soon, and you'll learn a little bit more about Dr. Churchill and what they're actually going to be focusing on. But I definitely wanted to give him a little bit of time so people understand that this Survivor Series that he just did live, who he is and what he's going to mean now to the organization. So what are your thoughts about on all that athletic stuff?
I, I, I'm like you, it's a good thing. I think sometimes, and I'm speaking about myself, I tend to beat myself up because, like, I get tired easier and I try to push myself. But what's good about this is the whole community of people that does something, that requires something kind of athletic or what have you, that they are walking or got some trials that they are confronted with, but yet they learn to persevere over it.
Mm-hmm.
Um, but I'm one, I love to see somebody, walk in and make it 10, 15, 20 miles. I remember when I used to do, but I can't do it. Sometimes, uh, I know with the aortic dissection, we all go through a depression. It come and goes. It's like not no completely gone away, but
Right.
it gets to me sometimes. But it's good to see people out there doing and actually inspiring others that it can be done.
That's the whole key. And you know
It's
what? Why
okay.
we should be champion everyone. I talked with somebody
Right.
else who is he is a he's also still a triathlete, and he was doing
Hmm.
Spartan races. So if you're not familiar with those, they're a little bit more like involved in the body, like, jumping in the mud, climbing over walls,
Oh,
obstacle
okay.
course type stuff. And his as well as some other people's perspective were that sharing that was just very jarring with people of this community. And he is a
Hmm.
dissection
Right.
survivor. And my takeaway after talking with him was he has worked with a team of physicians to share what his passion and his love was before this happened to
Hmm.
him. And it was extremely important to him that he be able to see his life in that realm in some way, shape, or form. And they worked with him, and they monitored blood pressure, heart rate, everything for a while he was going through rehab and working out to figure
Mhm.
out his fitness level and figure out what he should and shouldn't do. And he ended up switching into triathlete, and away from Ironmans and stuff like that. I'm pretty
Mhm.
sure I have that right. Got off the Spartan races, got into, the triathlons, and
Right.
through the advice of his physician. So this isn't like someone that's going rogue and just powerlifting on their own after being told no.
Mhm.
This is somebody who, I'm passionate about this. And the philosophy almost is, it's like, if you're telling me I have to just sit down and live in a bubble and I'm going to die one day from doing nothing, I'd rather live my life doing what I love, being monitored by you, because I'm going to die anyway, because we're all dying. So he would
Mhm.
rather do this his way, in control, with the doctors following him. I'm not sure how much they support it, but they're at least following him, and he's working with the
Right.
team. My
Right.
takeaway from that was, is I can do anything I want to do as long as I'm working with my team. And if they say no, you may not, I'm like, that's fine.
Mhm.
What else can I do that might make me still feel that
Right.
good? Get me there. Help me train to get myself there. So I look at it as very uplifting and motivating, just like you. Yeah, that's the right word. It's
Mhm.
motivating, you know?
Yeah.
Okay.
Now, the thing about it is when somebody sits there and they do it anyway, don't be critical, criticize that person for pushing themselves, because it's what
Mhm.
makes them happy. It's the
Exactly.
way they choose to live their life,
Their choice.
and it's just like me, if I'm going to go down, I'm going down my way,
Hmm. Right.
so I mean, yeah, so I don't think that nobody should sit there. Well, he's got an aortic dissection. Doctor says he shouldn't do this, and he's just asking for trouble, whatever. Let him live his life,
Right. Right.
and you live your life, and he'll live his life. But he could inspire somebody, and you never know.
Yeah. As long as they're not saying, if I can do it, you can too. Because
Yeah,
that's a
right.
falsehood statement
That's
right there.
exactly.
Really, only thing someone should be saying is, through working with my physicians, I've been able to
Hmm.
establish this is my routine.
Right.
Therefore, if there's something that's important to you, talk to your physicians and see if you can make it happen. That's the only
Hmm.
message. That's it.
Hmm.
What were you going to say, Josh? Let us know what's going on.
Uh, well, let's see here. Rob jumped in to say hi.
Hi, Rob.
Hi, Rob. He says happy Monday. Christina says, I like when he said that he took blood pressure cuff with him when he was jogging to stop and check.
Nice.
And she said that she did the same thing when she took on swimming. She laid it on the edge of the pool,
Hmm.
right? And
Yeah.
she said, I found I could swim and do water aerobics and adding another blood pressure pill when I did that. And I said, another pill. And she says, when her high number reached 130, she immediately stopped. And
Hmm.
now, when that number hits 130, she takes clonidine under the tongue.
Okay. That's interesting. I didn't even
Yeah.
know there was one under the tongue, but that's cool that
Yes.
your doctor worked that out with you. I know okay, don't laugh, but I just realized that I can wear my Samsung Galaxy Active Watch in the water. I found the waterproof button that I didn't know existed. I told you. I remember I heard about it through you, Diane. And so I was at the pool and I put the waterproof button on. And then when I got out, I held the other button and it started going spitting at me
It
because it was
does,
blowing the water out.
literally.
This is the greatest invention. But
It's
I
so
did.
cool.
It's so cool. And I
So
was
cool.
checking out my heart
Yes.
rate. And when I saw that it got to about 125, 130, I just stopped giving 150% and cut myself down and just, kind of treaded a little bit, dunked my head under, just quickly got my heart rate down and then went right back forward again.
Mhm.
So that was kind of cool that I don't take my blood pressure, because I can take it after and see how I recovered. But I definitely keep track of that heart rate while I'm in there for sure.
Okay.
Hey,
And
Karen,
oh,
go
go.
ahead.
All right. Well, then Rob said, all of us here in Michigan have COVID.
Oh,
I know, right?
no.
So before I could
Oh,
ask how, he says, my grandson first, then his mom, Mindy next, all had or have flu symptoms. I don't have any symptoms yet, nor my son in law or other grandson. And then he says, the kids at camp brought it home. And I was going to
Oh,
say, first day of school? Like, imagine that. First day of school, right
wow.
away, bam, right?
yeah.
Mm.
Well, all I can say is, just because everybody else seems to have it around you doesn't mean you're going to get it. I have had my husband have it not too long ago and I didn't get it. And then I just recently got it and he never got it. So, staying away and having the right person be masked and just wiping things down, even though we washed our hands constantly, we just, living in the house, just the two of us, we never got it
Right.
from the only time we both had it at the same time was in 2020 at Christmas because his daughter came home, and even though we sat at opposite ends of the dining room table, this is back when it was so in the beginning, right? We had the windows open because that's what they said was good, and we had winter coats on eating dinner. It didn't matter. We all ended up breathing in the same air and whatever. But this time around, we did avoid each other. I'm so sorry. I hope everybody recovers, quickly.
Yes.
It's
Yeah.
not fun. I'm still coughing weeks later.
And that's what I was
Uh-huh.
gonna say. Watch for this cough that Karen's got. She's been coughing for what is this
Yeah.
like the third week now?
Yeah.
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 And that first
Yeah.
week was whoa. Sounded
It was
like you
so
were
bad.
coughing everything up. Everything you've
It was
ever breathed in your entire
everything.
life.
My whole life. Yeah, that sore throat was, it felt almost worse than when my tonsils came out. I mean, I was crying. I didn't, but that was really bad. But yeah, the cough is and the cough is not good. I mean, we're not going to die from coughs, but too many, upper respiratory infections, too much coughing. I'm not seeing the six pack from the amount of coughs that I have done. And there should be something in there, but you got to get through way too much jiggle to get to anything that feels like it might be a muscle. Well, I'm so sorry to hear about that. I hope you guys recover quickly and easily.
Yeah, he says we
Yeah.
practice good prevention measures, but with kids and 6 of us in the house, it is
Right.
difficult.
Kids are like walking petri dishes. I mean, kids are great, but they're just germs on two legs.
Walking germs.
They really are. That's what I picture. I just see a COVID walking with two big legs, like a little animated thing. Yeah, that's what they are.
Okay. So right here, Rob was asking about Christina. He says, I run from 110 and up to 140 at times, sometimes higher. My doctor has never had me take anything to lower it immediately. Christina says, I'm scared to get it high.
We are talking blood pressure and not heart rate, correct?
No, that's a good question. Blood pressure, high number, reaches 130. Take clonidine under the tongue.
Okay, that's so interesting too, because like for me, a normal day for me, if I got to 130, nobody would really care. Once I start pushing 135, then it might be drink some more water, or did you take a diuretic today? But interesting.
Well, then she says this. She says, I had a headache for 2 days until I found out my headache was because my blood pressure was over 100.
Right.
Oh, wow. So you're probably somebody who traditionally ran low,
Yeah,
like
maybe that's what I was
lower,
thinking
like in the
too. Maybe she
90s,
was in the other, yeah.
Yeah, and so that makes sense. 130 would not be comfortable for sure. Yeah,
Okay.
that's great. All right.
I have to take clonidine whenever mine goes up to 130 with my blood pressure. But
You
I
take
have the
130?
same thing and I
You take
put
it
it up underneath my tongue and then it
Really?
leaves me with a naggy headache. But yes, I've
I'm
heard
on a
of that.
clonidine patch, a new one every week. I change it out.
Uh-huh.
But that's just because I don't absorb my meds correctly all the time. So at least I'm always getting it through the skin. It's always there.
Well,
Interesting.
I'm glad we learned a little something today. That was even better.
Yeah. And I'm also curious to know, and I don't know if any of you are experiencing this in the areas where y'all live, but I went to go pick up clonidine patch from Walgreens, and they are out with no deliverable date, manufacturer. And they said, the pharmacist said, in the 20 years that she's been a pharmacist, she has never seen it this bad right now, where people cannot get commonly used medications by putting in their script, that the manufacturers are not, they're not manufacturing. I actually just went to get something from my dog that is very common. And it was interesting. They tried to refill it 90 days, and the manufacturer's like, we don't have it, but I could do it at the 30-day. So it doesn't make any sense to me. But there are a lot of medications evidently that are pretty common practice, and people are starting to really struggle finding them. I had to go to, I went to like Safeway food store. They didn't have them. CVS, they had them. But I was like, give me 90-day supply now, because this is not a drug you can cold turkey. When you're taking clonidine, often you've got to wean. So, check in with your pharmacist, see what's going on.
Good to hear. Okay, so we have a little bit more numbers here.
Okay.
Christina says her normal high number is 115 max.
That's 15 points higher That's interesting. Well, I guess if I was like running 130 to go to 145, I'll feel it and it'd be
Mm.
bad. That would be ugly.
Mhm.
And so Rob
So,
says this
yeah.
morning he was at 160 over 78, and then it went down into the 130s in a couple of hours.
Yeah,
Is
you
that
probably
when he
took,
first wakes up
that's a good
upon
question
waking up?
too. Yeah, because
Yes.
in the morning it will be higher, but it shouldn't be that high. That means you're missing
Mm-mm.
something possibly at nighttime
Well, I
to cover
wonder if
you
that's
into
going
the
to be
morning.
him realizing he's got COVID now, and he doesn't have any other symptoms.
That could
Ooh,
be, and you probably should test anyways. And also check your heart rate. And
right.
if to Rob and Mindy and family, make sure you guys have at least a pulse ox people can share, that your oxygen levels never dip below like,
Mm-hmm.
92, 90.
Oh, okay.
Um,
So he says my blood pressure has never been that controlled since the dissection. This
hmm,
recent drug mix has done the best job, but still not consistent. And I remember him saying he was having some changes, even
yeah,
right after his last surgery. They were still
so
working on
interesting.
that next batch for him.
Yeah. I
Mm-hmm.
know that's got to be frustrating. I don't know. Maybe it makes sense to ask about clonidine patch. Then you're always getting something consistent, and
Mm-hmm.
then they can work around it. I don't know. It's so magical and mystical what some of these cardiologists, and these people in these aortic disease teams, how they're able to just look at everything. I think the key is that we don't try to be our own pharmacist and self-medicate when we see it rise, unless you've been told
Hmm.
to take something. But
Right.
don't do it willy-nilly. You know what I
Yeah.
mean? Like definitely talk to your doctor.
Now,
That's key critical.
Now, all that
Yeah.
being said, okay, we're still talking about Jack Crow. This is all from the Jack Crow bring his
All
blood
from
pressure. His
exercising, right?
story
See,
was
look at that.
riveting. Was riveting.
Gotta
Okay?
check it out.
And
Yep.
and at one point he's just like, I'm just gonna tell you all of the bad decisions I made. And he
Uh-oh.
just starts going down the list of bad. And I was just shaking my head. I was like, "Oh my god, no way! Oh my god, no way!" And he's such an amazing storyteller. His story is definitely one to watch. Definitely, very good.
Gotta check it out. All right, we're moving on to Scientific Sunday. Genetics 101 with Ryan Rodimer, Director of Genetic Education. I think this might be the last one for a little while till we start back up again. I mean, we've received so much incredible information that's all located on the right-hand side. When you click under blog, you can just go right to genetics and you can just read them. But we were wrapping up this series, and really, in this particular post, we were exploring what to expect during your actual genetic counseling appointment. So, a lot of people are participating as they should with the John Ritter Research Program. That is very different than having a clinical visit. The research program will ask you a lot of questions, hopefully by phone. They're going to send out a big, huge history in the mail for you to fill out and a spit test
Mm-hmm.
that you can send back. And trust me, it is not that easy to come up with that much spit to fill that test tube. I don't care how much you think about lemons. I'm like lemons, 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 and you spit and you're like, it didn't even go anywhere. Like where did it go anywhere? It's like nothing there. Uh, but when you're doing it through clinical, there is a way that you can kind of be best prepared for this appointment and you should kind of know what to expect. So before you even set foot in that genetic clinic, you really need to do some groundwork. This is really
Mm-hmm.
important. So that preparation can come from phone calls, paperwork that the clinic provides you, asking for necessary information about your medical, your family medical history, all of that. So when it comes to your medical history, you kind of want to have a good sense of your own medical history. Don't take anything for granted, I'm sure, but you really want any details that have to do with your aortic dissection, any features of a larger genetic syndrome that you might think you have. I also was told once, like, I had some snapping blood vessels on the pads of my fingers, and I just mentioned it on a whim, and they're like, "Oh, nope, want to write that one down too."
Mm-hmm.
Dental issues. It's important to write that down too. Like, I don't know. I just say tell them everything and anything. They'll determine what's important to their detective work, I should say. Okay. Family history, when it comes for that, if you believe that some of your relatives might have had a connective tissue disorder, might have because you've heard various things, you want to write down their symptoms, the things that they've experienced. And if Ryan's still on, I'm thinking that they tend to ask not like second cousin, great aunt, I think they're going in the line. So yourself, your parents, your grandparents, might even go to great grandparents, possibly just an aunt. So right off of your parents. I don't recall it going any further than that, but if he's still there, he can answer that question for me. But anything that you know about their symptoms can be very, very, very helpful in identifying any type of patterns that might indicate a potential for genetic predisposition. And photos, believe it or not, would actually be really beneficial. So if you knew that like Grandpa Joe was really skinny or, had really long arms compared to his torso, like you might want to bring a picture of that if there was something that you thought was off, or if somebody had an unusually high palate that the family took a picture of because it was entertainment at Christmas, bring that picture in with you. You know what I mean? It's just really flexible. A relative who may not be around anymore, but you can see the flexibility and elasticity in skin, bring that picture with you. When you get to the clinic, very simple, kind of like a lot of doctor's appointments, they're going to probably have a medical assistant that's going to take your height, take your weight, take your blood pressure, blah, blah, blah. This can vary clinic to clinic, but just expect it, just in case they ask for it, okay? And after the vitals and your medication history, just like any normal doctor's appointment, after all of that has been taken, and again, this does vary by clinic, that's when you're probably going to meet with your genetic counselor, and they play a very vital role in this genetic counseling appointment. So their job is to actually gather your medical history and your family's medical history. They're supposed to provide you about education about potential genetic risks, including if larger genetic syndrome or hereditary aortic disease is suspected. They're supposed to educate you about what that looks like in you possibly. Explain what an inheritance pattern actually is and what it might mean for you and your family. Talk about genetic testing, its costs, potential insurance coverage, and also talk about genetic discrimination laws. Now, those are very important to find out about. That was new for me, talking about that in one of my sessions, but it's not a short appointment. Okay. So they're like flow charting all of this stuff out, and whatever they're asking you, you want to have as much information as you can. Or like, I forget what that TV show was, with the suitcases. What's that called? And the girls, they hold the suitcases. What's that called?
Deal, no,
Yeah,
deal.
yeah. And you're
Yeah,
gonna
yeah,
dial
yeah.
somebody
That's
up,
it.
or maybe it's a different show. But oh no, it's the other one, whatever it is. And Who Wants to Be a Millionaire? And you're like, can I call a Lifeline, a friend? So it's a totally different show. Yeah. So you want to maybe also have somebody on speed dial, like a parent or another relative that you can ask questions if you
Right.
forgot. Okay. So a physician will actually be the one that's going to probably perform your physical exam, and that's also usually a geneticist. And the physical exam's actually looking for some features that could lead them to thinking that maybe this is a known CTD or connective tissue disorder like Marfan syndrome or Loeys-Dietz or vascular Ehlers-Danlos. So if one of these is possibly suspected, they may actually provide additional information and then discuss the implications with you in case you need any type of other genetic testing. So undergoing genetic testing is a very personal choice. It's a very personal experience and a personal decision. So it's the job of that genetic counselor to actually ensure that you're making the most informed choice possible, and you're never obligated to proceed with genetic testing in certain areas. I will tell you that my last test, based upon my family medical history, it was suggested to me that I add 2 other tests in. And I was a little concerned because I'm like, I don't know if I want to know, but maybe I do, but maybe I don't. And then we had a whole discussion on what these other tests looked like and what the results could possibly be. And then I made the decision to move forward with it. So it is definitely, like we talked about with doctor's appointments, very relationship driven. But after the appointment, this is also important too. And then Diane, I'm curious to know if you've done any of this. So it can take about 2 weeks for genetic tests to come back. My place said possibly could take 8 weeks. Just it comes back a lot quicker than a research study. I'll tell you that. Okay. Once they're in, someone from that office, either the physician or the genetic counselor, will usually call you with the results, even though you probably can pull them up on a portal and you'll see. But what you're going to see is a gazillion letters and numbers, tons of different tests in these panels. And that can necessarily mean anything to you, especially if you get certain results. you might have a lot more questions if it's not just positive. If it's something else, you might have more questions. So these are the things that could happen based upon results. This is just to set your expectations. So they might recommend a follow-up appointment to kind of go over these results with you and what they think your next step should be. They might actually provide additional referrals, additional genetic testing, or actual imaging that they think you should probably have based upon a result. If a genetic syndrome is actually identified, then they're going to suggest to you for sure having annual follow-up visits. They're probably going to be recommended. And if relevant, they might actually advise evaluations or genetic testing for other family members. So those are all the things that could actually happen. In my particular case, when a certain gene was discovered unrelated to the dissection, it was recommended that I immediately have a cardiac MRI and talk to my cardiologist, which I did. And I learned all about this gene that I have and how I learned specifically from Ryan that this gene, just because I have it, doesn't mean it's been turned on yet and it's active. But it's a good thing that I know, because now they can look for things in me and decide the right types of diagnostic testing they might want to do. And if they start seeing changes, the right medications or procedures they might want to put in place. So not knowing is scarier in this particular case. For me, I feel that knowing is better, but everybody has their own opinion. Some don't want to know. They don't want to mess with anything, the law and order of life. And I totally respect that feeling as well. So you have to make your own personal choice. But the genetic counseling process is a very thorough process, and it's really designed to ensure that you're informed about everything and every step of the way. So undergoing genetic testing, again, personal decision, very personal decision. And your counselor is there to make you feel comfortable and helping you make this informed decision. So they're not supposed to pressure you into having the testing done. The process is, it can seem a little overwhelming, but it is really kind of a crucial step towards understanding your condition in its totality and making management for your disease or potential situation more effective. It's also an invaluable way in understanding and managing any potential genetic risks that your other family members may have. That is also the key too. They will not test your children if they don't find anything in you. If it's not in you, then and it's not in your spouse, then it's probably not in your child that they would be hunting. This is not easy. It's not like, finding a red button in a sea of black buttons. It's like finding a sea of black buttons and we're finding half a grain of rice. It's probably harder than that. So that's been painted black. So let's just make it really hard. So they really have to look at all of the information to make their decision what type of test and if they're going to move forward with those tests. So not something to be taken lightly, but this is a long appointment and it's a little bit of a process. But for those who choose to go on this road, well worth it. Now, Diane, have you had any type of genetic testing done?
I have.
Okay.
I went through the John Ritter when they had that kind of the testing done, and it took a while for them to get back to me. And then I received a packet from them. I'd say about 3 or 4 months later, totally forgot about it. But yes, I got a package, and in that package, I received like something that I really didn't understand, all them numbers and stuff, but it did have some genetics involved with it, and it did a letter was in there saying about having my children tested. I called my children and told them, look, y'all need to get tested. And for some reason, they're boys, and they said they did not want to know. But, I myself can't make them, but I told them I don't want you to ever, have something happen too soon. You know that there's something that needs to be addressed. I'm telling you now, this is what I have. This is what's found. This is genetic on my part. So that's all I could do. But they choose not to know.
Did they actually find a genetic reason, or did they find a VUS, which stands for a variant of unknown significance? Did they find actually something?
Yes, they did. As a matter of fact, I gave that to Dr. Cavender has a copy of that, and I gave it as well as Dr. U. Daly. Anything medical, I gave to them, including, stuff with my connective tissue disease. I gave them all the tests that I have done. I gave them all all my paperwork.
So,
On
you know what?
everything.
In that case, even though we realize there's a 50-50 chance that your sons can have
Right.
whatever variant mutation or whatever it is that you have,
Hmm.
they can, in the very least, should treat themselves as if they already have it. So that would require just to be seen and have an echo or a CAT scan or an
Hmm.
MRI or a TEE we're hearing now. So have any one of these tests to get a baseline and
Hmm.
let them say, oh, your aorta looks perfectly normal. I'll see you in 3 to 5 years. Let the specialist make that decision.
Right.
But I would never recommend somebody be like, oh, I don't want to even ever know, because the whole goal is if we can figure out that there is something has changed in your anatomy, they can start medications right away. They
Right.
can maybe have a scheduled surgery, because to risk the dissection where there's such a
Not worth
high
it.
mortality rate on the initial just seems, that's not good, right?
Oh, it bothers
Yeah,
me. It bothers me, Karen.
yeah, yeah. Yeah, my son, we've had this discussion many times, and I don't want him to be genetically tested. Now, my mind has come back with nothing except a variant of unknown significance. So it means there's something, but I kind of think of it as there's something, but not enough people in the world have the same something for it to actually be now called a something. So it's a, we're not really too sure. We're just gonna keep our eye on it type of thing.
Hmm.
Um, and I just said no. So, to me, I don't want my son to know because I think he's still too young and he'll fixate on it. And do I feel something? Do I
Hmm.
feel something? Do I feel something? I'd rather him go for his echo and go for his CT. And, if everything looks good, see you in 3 to 5 years. And then just keep going to get monitored and to look for a change. And take your blood pressure every now and then, see how you're doing. If you're doing good, you're doing good. Just kind of, you've stepped up your game from not knowing to thinking maybe there could one day be something. So let's be proactive,
Okay. Yeah.
you know? Yeah,
Just be aware of it,
just
right?
aware.
Aware.
Awareness is key. Early diagnosis is key to
Hmm.
maybe not needing such a giant intervention. That's the whole concept of think aorta, think family. Let's have these talks. You don't have
Right.
to be genetically tested. Just treat yourself as if you already have something. Just be that kind to yourself, as if you already do.
Mhm.
So, all right, Scientific Sunday is over. Let's talk about some of our events that we still have going on. So right now, coming up, we have our Aorta Hangout, which happens every Thursday at 2 p.m. If you're looking for an environment where you're just going to hang out with a bunch of crazy fun people, not talk a lot or at all about heavy stuff, like a support group. This is truly like you're all sitting around in a virtual cafe or bar and you're just hanging out. You could be cooking dinner, you could be planting flowers. Who knows what you're doing? You could just be telling jokes, because I've been there on joke day, just hanging out with people. Then you should sign up in for our support group meetings, because you will actually receive a link to join the Hangouts as well as those patient slash caregiver meetings, the joint meetings. You will never get a link to the caregiver meeting because that is a very separate, exclusive little club over there. But you will get meetings enough for, on average, for 6 times a month, the 4 Hangouts and then the 2 different support group meetings. So that's coming up. It's a lot of fun. Then on Saturday the 19th, we do have our caregivers virtual support group meeting that has its own link, that lives in its own land. They have their own Facebook page for caregivers only that you can sign up, and that happens twice a month, and you will receive a link just prior to the start of that meeting. Sign up one time. Then we go back to our weekend reviews and our end of the year virtual support group meeting, which will happen on the 30th. So a couple other things that you're going to start seeing over here over the next couple of days is, I believe it's September 17th, is Run for Aortic Health, 5K or 10K happening in Texas. You can also do it virtually. When you register, you'll receive a t-shirt and you also get your medal, which is so fun. I have a nice little collection. You go do whatever you want for the day. Take pictures of yourself walking with your family. She loves seeing what everybody's doing out in the community, but that's a really fun time. Even if you're not there on site, you can still contribute and do it from your home base. In addition, we have bingo coming up in September. That is going to be on the night of the 14th. That will start at 7 p.m. We have, again, as we mentioned, our aortic disease awareness day that's coming up on the 19th, where we will be having our hope campaign. This is what hope looks like. Our 5th annual campaign video will be shown on that day, but drum roll. Look, our countdown 21 days, 17 hours, 50 minutes,
Yes.
and less than 30 seconds to go before the launch of the actual book, The Aortic Dissection, the patient guide launches, when we hear the cheers in the background. Now, before that, our free download will be coming up soon. That is coming up very shortly, but the actual tangible books that we will be shipping to your doctors will be coming up and dropping on the 5th. And this is, if I talk about it too long, I'll get emotional, but thanks to the extremely hard work and efforts that were put into creating this guide by our friends at Aortic Dissection Awareness UK and Ireland, we were granted the ability to be able to bring this book to you with all of the US information. We've had our own clinical coordinators working on this book, some representatives from the patients. This is really truly a guide by patients for patients. It's very easy to understand information, including a lot of links to the support groups that you're all used to hearing about out in the community. I can't wait to hear back on our surveys from people that can tell us what they were feeling and what they experienced beforehand to after reading this book, how educated and how much more supported they feel afterwards. So that's truly amazing. And I also think that by reading this book, it's going to make people understand why it's so important to go back for follow-up appointments and monitoring. Too many people, once they're fixed, gets too scared. Like, I'm not going back for that. And they think that because they've had surgery, they're fixed. You got to go back for your monitoring. You really have to. So we're super excited about that. You're going to hear about this quite often now. And so that's kind of what's happening. We have a lot of live events in the month of September, a lot of live events, a lot of information, 7 days a week, every single week of that month, lots of giveaways. What you got going on over in the Aortic Health Unlimited world, Diane Bishop?
Oh, we have several things going on. But first of all, for everybody out there, I want to congratulate you, Karen Sue Anderson, who had won the Golden Aortic Pin. Golden Aortic Pin goes to anybody that is nominated for being bringing knowledge and helping people out there in the community, and for all the work that you do. You have been nominated, just to say, 4 different times for 4 different people, and we encourage, is available to anybody, your doctor, your friend, your aunt, anybody that you feel deserves on bringing awareness to the community or to anybody, because you don't know the difference that you make in someone's life. And we do this every 3 months. At this time, you could go to our Facebook page and nominate anybody. Just send me a letter, and we will consider that position. And it goes on every 3 months, and the winner gets a certificate and is a cool golden pin of an aorta. It is very cool.
If you don't have your glasses on, it kind of sort of could look like a clarinet, but then when you look at it, you're like, oh my God, no, this is an actual aorta. It's really cool. And I truly appreciate the sentiment behind that. And as you know, everything that we do is a group effort. So I, share that with everybody on the team of Aortic Hope. But when's your next one going to be announced? How long do people have to submit?
You got till October, I believe.
Okay.
What month are we? August, September.
Already in August, yeah.
Yeah. So you have time, and if you nominate someone, they don't get it now, don't mean, you just have to put their name in one time, and that's all you have to do. But being, for everybody out there, Karen had started this group with some other girls, but the group has grown so much. There's something out there for everybody. Something out there for you. You may not like this, but you might want to participate in this one thing. But there's so much knowledge and wisdom that you get from it. And also, you meet other people. And I'm so happy to be ambassador for y'all. And I thank you for that.
We love it.
So I encourage everybody, submit your names on anybody. Go to Aortic Health Unlimited on our page. We are working on our page to upgrading all that. So just give us a few more probably weeks to get that up and going. to where you'll see us not just on Facebook, but we will be on Instagram and Twitter and all these other goodies. But we're so happy and we're so proud of you, and we thank you for everything that you do and for the time that you put into it, because you know, your time is just as valuable as everybody else, and your commitment that you have on helping others.
Yeah.
I thank
Well,
you.
you're so welcome. I call it selfishness turned into selflessness.
That's
Everything that
it.
I've done, all the things I've come up with, it's all because I want it myself. So if I want a jar opener, I would decide Hope Mail will be a jar opener so that I can have
Mhm.
one. If I, if I want to hear somebody's story, so I told my survivor story and waited to see who else wanted to share.
Right.
Everything comes from just an idea. And believe me, there's been a few ideas I've had that were doozies that were they were definite failures, but you got to try, and
Yeah.
and we wouldn't be where we are if it wasn't for the board is just all volunteers. I mean, nobody derives an income. 100% of the money we raise go right back into these programs for the community, and all of us have aortic disease. So
Right.
even the one member that doesn't have aortic disease understands chronic illness, and she's been more like family to me, and that's our treasurer. And so, but everybody else has been touched by aortic disease, whether they're a caregiver or they've lost someone or they're a patient themselves. So thank you, Diane. We always appreciate everything you do for the community, as like you're like the big 411. You're like the big, when we used to dial the operator, when these kids
Uh-huh.
don't know what that is, and call information or the number for the time or the weather, right? Because
Right.
we didn't have it at our fingertips on our watch or our phone. We would call the time. What was it? 844-1212, and I think the weather was 936, so that they could, at the tone, the time will be, it'll tell you the time on
Yeah.
the phone. Yeah, you're like the operator. Oh, you
Mhm.
made me think. I do want to mention Rock from the Heart. They are like, their registration's out, right? Isn't it out already? They have
Yeah.
events happening in February and May, and I think they're
Yes.
starting to they want ideas shared on their page of questions you might want answered, speakers, topics, the whole nine yards.
Right.
The registration information is up, but they're also getting ready to go live on their silent auction on August 16th. All of the
Hmm.
money they raise really help them to put on an amazing symposium, both in person and virtual, when they have their event. This year is going to be in St. Paul, not Minnesota. I mean, Minneapolis, it's going to be in St. Paul, Minnesota. And then, of course, there's a concert. I don't have any of those details. And then they're going to have one in May in Fargo, which is just which they will also be having their symposium as well as their dinner and a concert as well. So if you've never attended, now's the time to start thinking about those dates. Check out Rock from the Heart's page. And if you have questions, you can always reach out to their founders. But we'll have all those details up on our page soon. There's just so much going on. So much.
That's so fun to go to.
So
So fun, right?
so
Yes,
I'm
it is.
sorry. My thoughts about 2023 will be the pinnacle highlight of my lifetime.
I know
But
it.
it was just such good information, and it was so great to see faces with names of
Hmm.
people that we talked
Yes.
to. That
Hmm.
honestly is really, that is true. If I want to be really honest, that is the highlight. But Rick Springfield was a pretty good highlight too. So there. All
Good
right.
memories.
That's it. That's our weekend review. Hats off to you. Thank you, Rob. Thank you. What other names do we got? We've got Christine. We've got uh uh
Ryan.
Ryan. Did I miss
Hmm.
somebody else?
That was just our chatters.
Oh, we talked so much about Jack. I thought maybe he joined us.
Yeah.
Nope, we were just doing a lot of chatting about him. All right, thanks, Joshua. I got it right. I said the whole name. We will be back on Monday again, 3 p.m. Eastern, to chat about everything we post in this upcoming week. We've got so many things coming up that I'm sure we'll have more to talk about soon. So don't forget to sign up to join us in this week's hangout. We look forward to hanging out with you, and we'll see you soon. Thank you so much. Have a great week. Click like and subscribe. Bye.
Bye.